Topic here. We're joined by Yoran Bar, the CEO of Beaconcure. Thanks for being with us here. If I understand correctly, your company collaborates with Pfizer, one of the world's largest pharmaceutical corporations, now to introduce new drugs and vaccines to the market. What are the chances now for a COVID vaccine anytime soon?
Beaconcure is working with a few drug development companies on accelerating the introduction of new drugs and vaccines in general. The technology that Beaconcure is introducing is the ability to cut down the timelines from the moment that the actual trial ends. So you can imagine that with all the data that's coming in up until now, the manual process takes between 5 to 8 months. What Beaconcure does, it's introducing automation that takes the data from the actual reports, convert it into code, and then we can compare between the data sets, allowing for much faster, extreme quality assurance checks. Having said that, we don't know what would lie ahead in terms of the COVID-19, and our technology is able to work on drugs and vaccines all together. This is just the beginning of the ability to introduce automation in the area of drug development. So validation is one thing. Generation of new data and insights is another. That also works for clinical, preclinical, and others. So you can imagine that introducing AI and automation of data handling is not just for acceleration to the market, it's also to get insights into already existing trials and data, and that on itself would support the acceleration of new findings for COVID-19 and also for anything that would come after that.
Well, where does this, in terms of COVID-19, now, say a vaccine is produced in sometime in the next year, does your company, or how do we get this to the wider public, in terms of preventing big companies from just buying it all up? How does it get distributed to the world?
Well, I have no idea how that works, focusing on technology itself. The idea of accelerating the introduction of drugs and vaccines, of course, is by cutting down the timelines that it takes to check the data from the moment the clinical trial ends. So imagine that if it takes 6 months from the moment that the trial ends to analyze the data, create statistical reports, create the medical writing, have it checked, and then deliver it to the regulator, those 6 months are avoided by introducing automated checks that Beaconcure offers. And by that, you can get the vaccines and drugs to the big markets 6 months earlier, which is a huge impact for the benefit of everyone. Again, automation and AI in the service of the drug development community worldwide is just the first benefits of getting vaccines and drugs faster and cheaper to the patients.
Well, we hope that comes into play with the COVID-19 work here. So, Yoran Bar, thanks for being with us.
Thank you so much.